just to finish, can I ask each of you what would you most like to see? What would you most hope for in the next 2 years? I mean, any Secretary of State has a Matt Hancock would like to hear this, quite a short time in tenure, and he wants to deliver this as one of his key priorities. And I guess we'd all like to help that happen. With whatever one might have, some concerns about the specifics. What would you like to see happen in the next 2 years, Jo?
I'd like to see the pace of innovation and implementation increase, so people taking risks to do things. I'd like to see those products that are successful taken up by the centre and rolled out across the NHS, and I wouldn't like to see a single solution trying to be placed across the NHS. Enable health and care systems to test out 3 or 4 that have been proven to be successful and run with whichever one they like. So choice within a framework for me.
Excellent, thanks. Shanti?
So I think it's important that we offer people flexibility, because one size will not fit all, and just because we all believe firmly that digital transformation is key, there will be, you can't examine people online. People do need to turn up to a clinic from time to time. And there will always be people who don't want to do that. And when we've done some research, people have said that they prefer a previous relationship with a clinician before they move on to virtual care. So there will be groups of people, there will be conditions, and there needs to be flexibility within the system. We need a mature way of funding. There's huge of funding outpatient care. There's huge disincentives within the system at the moment, and sometimes it's just easier and financially better to do a lot of procedures, to bring a lot of people, because there aren't very mature systems for funding virtual care, for example. So somebody needs to look at the whole tariff as an entirety, I think.
Thank you. Deborah?
I'd love to see these green shoots that we've been talking about today. This kind of parity of digital experience for, from life to our work in the NHS and what we do for the populations that we serve. I'd like to see some of that really coming to fruition, and things like, the user experience for everybody being an embedded part of the things that we talk about, and some of the things that we've got ambitions around that are projects that are real, that we've taken them forward and we've demonstrated that they've actually made a difference to sustaining the NHS and the people that we serve. So nothing big or anything like that.
Thank you.